into a depression because of the COVID-19's toll on the economy. We'll be looking at what we're into in Kaduna State and, of course, government's effort to still keep us safe. My guest this morning by phone is Dr. Zainab Mohammed Idris Kwaru, consultant public health physician and a senior lecturer, Department of Medicine, Kaduna State University. Okay, she's my guest on the program this morning, and we'll be looking at COVID-19. And of course, glad to say to you that Kaduna State Ministry of Health is the sponsor of this program. Dr. Zainab Mohammed Idris Kwaru, good morning, and glad to have you again with us. Okay, first, we'd like to take an update of what the situation is in Kaduna State. Okay, doctor.
Hello?
Okay, just so we can get an update of the situation in Kaduna State. Can you hear me, doctor?
Can you hear me?
Yes, okay, I can hear you now, loud and clear.
Hello?
Yes, doctor, I can hear you.
Hello?
We're glad we're back with Dr. Zainab Mohammed Idris Kwaru, our guest this morning, and we'll be talking about update on COVID-19 in Kaduna State, and of course I'll be looking at the situation we have in the country. We've been talking about what the situation is in other countries of the world. United States of America comes to mind here. That coronavirus still dealing with people and of course the economy too. Australia has joined the line, and of course it's taking its toll in these countries of the world. And for us back home here, for those that still say that coronavirus is not real, I'm sure Dr. Zainab Mohammed Idris Kwaru will confirm that coronavirus is real, and we almost keep to protocols of staying safe. And so, Dr. Zainab, the update of what we have in Kaduna State.
Yes, thank you very much, Mr. Turing. For us in Kaduna State, cases confirmed so far total about 2,163. Out of which we have about 2,043 that have recovered. And then we had recorded 31 deaths. And right now we have about 89 cases that are currently being managed in our various isolation centers. So this is the situation in Kaduna. And then what we have also recorded is that about 58% of those affected or infected are male, while 42% are female. And the age range of affectation is from 15 to 40 years, those that are mostly affected. And then we have the 35 to 39 year age group as those that are in the forefront in this infected.
Okay, doctor, what we have, also on ground is that in Kaduna State, we know that markets are reopened, schools are also, partly reopened, and of course, we're all busy, going about our businesses. But again, countries of the world are shutting down on these areas that we're saying that we can reopen on. What makes the difference? It's taking its toll in some countries of the world, but back home in Nigeria, what's the situation like after by not observing the protocols?
Yes, right now we're in the process of reopening various workplaces, businesses, schools, and so on, and worship places as well. So it's left to be seen. But then we continue to emphasize on the need to obey and comply with the safety and preventive measures. This is the only way we can really curtail the spread of the infection among the populace. And we really solicit for people to cooperate and give the maximum attention required for them to stay safe. And that's the message that we continue to push out there for people to take personal responsibility so that they do not in any way expose themselves to the risk of contracting the infection, and at the same time not put other people at risk of getting the infection. So we want people to stay safe and be able to take that responsibility so that they and their families are not affected.
There is serious. We have serious moves now to get a vaccine. For COVID-19. The world is very much on the move to do that. But let's talk about ourselves here. We all come from a background where we all are exposed to traditional herbs and medicines, and so for us, ailments like that comes with signs of COVID-19 could just be said to be treated, without herbs and medicines back in our local areas. How safe is this when we place it in by the side of COVID-19 and finding a cure for it?
Well, as you very well know, the infection and the pandemic is still evolving. We're still in stages where things have been, information is being generated every day as we move on as we progress with the pandemic. And I must tell you that even for us in Nigeria, we are not just resting, we are also doing a lot to see how we can also contribute to the global drive of getting some sort of remedy for the infection, including the vaccines, research for vaccines. And one of the things that Federal Ministry of Health has done very recently is to convene a meeting, a workshop sort of, and a conference of some sort with various traditional herbalists, various traditional medicine practitioners, for them to bring on board the different commodities that have been claimed to have some sort of potency on the infection. And they are right now conducting the various researches, and these herbalists and traditional medicine persons have come from all over the country. So we're expecting and hopeful that something positive will come out of it. It is a drive and an investment that is right now being done to investigate, to find out the efficacy of those claims. So we are not also just relaxed and expecting other countries to do things for us. We're hopeful that certain things will come out of it. But as it is right now, there's no cure. There's no claim that has been substantiated to really be effective in terms of whether it's a vaccine or a medication for COVID-19. So this is the situation at present.
Looking at the structure, of society, talking about, the upper class, and if we do have a middle class, and of course the lower class, would this, in a way, be telling or taking its toll on the societal structure that we have? That for people on the lower rung of the economy, they may be, exposed to COVID-19 than those at the upper level, especially with information and enlightenment.
I believe from what we have seen so far and from the dynamics of the pandemic so far, there's no class that has not been affected. COVID-19 is not a respecter of social strata or social status. It has affected almost everyone in equal measures. So I believe this is something that we need to take home. The only thing is that we know that people that have the means to really seek for care may probably have a better chance of seeking for that care, while those at the lower levels, those poor persons and underserved people are probably going to find it difficult to access care. But the good thing about the whole arrangement is that as far as Kaduna is concerned, at least all measures are being taken to protect the citizens, and for anyone affected or infected with the infection, of course, the government has done all it can to provide the necessary care for such individuals. So this is the situation as at now.
Well, as at now, too, that you're talking about it, government would be seen to have done its own, done its part. But again, we are maybe said to be on our own now. It's left to all of us to, keep to these safety measures. But looking at the situation we have on ground, would you say, can you tell if we are really, really keeping to that, in order to keep ourselves safe?
Well, for us, we believe that quite a number of people are complying, but we still have a substantial number of persons that are really putting everyone at risk. And that is because they are really not obeying the safety and the preventive guidelines, the protocols that have been specified for different, entities, be it at the school or in markets and our worship places, and even in neighborhoods. We still see people moving around without masks. You see people going about their businesses without demonstrating the social distancing, physical distancing that is being emphasized. And you also see a lot of people not really, doing the proper hand hygiene that is expected of them. So these and many more reasons are really putting a lot of people at risk, particularly the individuals themselves, their families, and the entire communities that they come from or that they patronize. So this is the current situation, and then we keep emphasizing that people should really, really take personal responsibility. That is the only way that we can collectively, curtail the spread of this pandemic.
A while ago, I talked about the social structure that we have, and this time again, I want to bring in the lower rung of the society, where in the neighborhoods we see how we all live in these neighborhoods, close clusters, and all of that. Again, the fear that COVID-19 in these areas could be on the high. What are your thoughts on that?
Yes, definitely. If you look at the setting and the way people congregate, and even the communal way of life that we have, people are overcrowded in certain places, in their homes, where you have a lot of people living in an apartment or in a home setting, and then they are not observing all of these rules, at least the minimal, the basics that is expected of them. So naturally, that has put a lot of people at risk, and it has also added to the infections that keep recording day in, day out.
And again, when we talk about people coming out, at one time we know that Kaduna State had the mobile van for testing, and we also got to know that it was just to stay for about 6 months and would move to other areas. Now that we are here with what we have, people coming out, to get themselves tested. What would you say about people really coming out to get themselves tested?
Well, for anyone that exhibits any of the symptoms, that is those key ones that we have, like fever, cough, and then breathlessness or difficulty in.
Okay, welcome back. It's the program Perspectives this morning, and we're looking at coronavirus, and the update of it as given by Dr. Zainab Mohammed Idris Kwaru. This program is sponsored by Kaduna State Ministry of Health, all in a view to keep us or give us an update of what is happening, and of course why we must still keep to the protocols to have ourselves or keep ourselves safe. We're talking about issues that are coming out with coronavirus. And Doctor, one area that we left out, and I must talk about it because we see it all over. We've talked about reopening of schools. We've talked about our markets, our churches, and place of worships. The mosques are all fully operational now. And one area again that is of concern to us here is the public transport use. And what we're seeing here is that is an area of risk for for us. And so the public transport and how to we can manage the situation there.
Yes, definitely. This is one area of concern. We see people, exhibiting flagrant disregard for the protocols and the guidelines provided in terms of the way passengers conduct themselves, and also in terms of the way that the drivers and various other stakeholders in the transport sector have been going about it. The guideline is that there shouldn't be more than 2 persons per row in a seat, but then we see people overcrowding, and this really also puts a great toll and a risk to individuals that patronize this vehicle and even the entire community. So we also have been engaging and reaching out to the transport workers and transport owners to be conscious of the fact that there's a need to comply with this guideline, because this is another avenue and this is another mode of possible infection transmission among the populace.
Well, getting people tested, and of course, what we have to do to also for treatment. Could you give us criteria for admission, especially when people have been tested positive? What are the criteria for admission in the facilities?
Well, like I said, one of the things that we look out for once a person has tested positive is to evaluate in totality the person's circumstance, and to also rule out any possibility maybe of doing home management. And once one is found to be infected, immediately a team is set up to evacuate such individuals. Of course, the individual would have been counseled on what to expect and what he or she needs to do to be successfully managed in our isolation centers.
Well, I brought up this criteria for admission because, some people would say that, what we have is that government is taking care of everything, that food and medicines are provided, given by government. Are we having a situation where this, may be, overwhelming on government, especially with what it has on ground?
The management of any case, whether it's COVID or not COVID, requires that people also make personal arrangements. Government is not promising to give everything. It's not going to be the same as what one is used to in his or her home. So people are encouraged to also take along whatever basic necessities they may have, which the centers may not be able to provide. But as much as is practicable, government is doing its best to provide the needed care in terms of medication and other basic needs, which includes feeding. But like I said, there are certain things probably that individuals are used to, which is not part of the package or part of the arrangement being made in our isolation centers. So anyone that is eligible to be conveyed to the isolation centers, they are encouraged to carry along some of their own basic needs, which they may require and which may not be available or provided by government.
Well, what we're doing here is public enlightenment, especially for the people to be aware that COVID-19 is real. And I want to look at it with government, what government is doing, information and all of that is coming out. And of course, getting the right persons, to talk to us about, COVID-19. But I want to put it, side by side with myth that could be, on COVID-19, which one is taking the upper hand here? The myth, and that's talking about what our people believe in. Are we having a crisis of the two side by side?
Yes, definitely there are myths and misconceptions that surround the epidemic, and all of this is generated for several reasons. One, if there's no adequate information about the infection, its modes of transmission, and how people can really prevent themselves from contracting the infection. And then there's also fear of the unknown. People do not know much about this disease, so it's causing a lot of havoc, a lot of misunderstanding, and people misinterpret or misconceive some of what they see. And they can also allude it to other cultural norms that continue to inhibit individuals from taking the right action in terms of prevention. So this exists, and that's why we carry out programs such as this, and people are encouraged to really seek for the right information so that we are on the same page in terms of getting the right information for people to make informed choices. So this is what we have, and we continue to emphasize and also continue to provide the information surrounding the entire scenario of the pandemic as we know it.
Well, Doctor, again, I want to bring in family here, and that's talking about where it all starts. That from how is family, to take responsibility of enlightenment, and of course what we do when we go out. But what would be the family responsibility in this, in trying to curtail and giving information on this disease?
I think what families can do is to continue to talk to each other, to dialogue, and to also exchange information in a way that is empowering, that can help people stay safe. Mothers, fathers, children, and various other members of the family would need to necessarily take the right decision in terms of staying safe. And when any one of them is venturing out, the need for them to comply with all the preventive measures, particularly wearing of the face mask, and also combining that with hand washing, and also the respiratory etiquette, the cough hygiene that we keep talking about. And then we also encourage individuals when they go out, and these are the things that should be discussed in families, to be able to maintain that social distance, which most often than not people tend to forget. And then we want to emphasize that families can do so much in calling the attention of their members to stay safe and to also comply with those safety measures and taking personal responsibility. This is what we mean by our forward campaign in Kaduna State. We want to move forward. We want to learn to live with the new normal, and by doing so, we must comply with these safety measures. And if there's no need for us to venture out for any reason, it is better for individuals to stay back home and continue to take care of themselves, eat the right kind of food, maintain the right kind of hygiene, and then also exercise frequently. These are the things that we talk about, and that's why we're now in a phase where we need to move on with our lives, and we also need to learn to live with the new normal.
With the stay safe measures that are on ground, again, wearing of this face mask, and of course the personal hygiene, coughing on bent elbows, and of course social distancing, and all of that is one, above the other in terms of priority or hierarchy. Because again, we're seeing all over the world that face masking is more emphasis is put on face masking. Is one above the other in all these measures on ground?
One will not take precedence with the other if we are not able to combine it. It's very important that as we're complying with the respiratory hygiene and the hand hygiene, that is the hand washing and various other issues that go with it, it's also very important for people to use the face mask. Using the face mask alone, again, does not confer any immunity to the infection. What is paramount is that we combine it with hand washing, and we also maintain the social or physical distancing that we keep talking about. So one doesn't necessarily take precedence over the other. What is important is for us to make sure that we protect ourselves and we comply with these very key measures that will help us keep safe.
Well, Doctor, you talked about the new normal that we're in. When again we come, to have a vaccine that would, give cure to COVID-19, would we go back to normal?
Well, that is a very key question that no one at this moment will give you any response to. What is important is that there are efforts being made to ensure that we get these vaccines or whatever medication is required for people to be able to address this infection. And Of course, estimates or predictions have been made, and it is left to be seen because the pandemic is still evolving, and the world over, countries and nations are really interested in getting some headway in addressing this pandemic. So no one can really tell you this is the time. Estimates have been made, people say in the next 1 or 2 years. So what is important for us to do right now is for people to really stay safe and remain safe until such a time that the vaccine or whatever medicine is discovered to be of effect on COVID-19.
Well, we said that we're all in a global village, and of course, news travels, all over the world in a minute or two. And some people would say that they've been able to, cure themselves, by drugs that they have administered on themselves, and they were able to get rid of or come on top of COVID-19. With all that is going on, and these drugs that have been taken, is there a way that one can say yes with what one is getting? Yes, we can use these drugs too to keep ourselves out of COVID-19.
Let me quickly correct a misconception here. There's really no cure up till now as far as COVID-19 is concerned. What is happening is that people are being managed for the symptoms that they present with, and then the infection runs its course, and then people recover. This is what happens, not because those medications are a cure for the infection. So I think we need to recognize that and emphasize it to people so that they don't think that those medications that they take when they come down with the infection are really a cure for COVID-19. Our immune system also has a role to play when it comes to people recovering from such an ailment. We've said it to that number that persons that have an underlying medical condition before they contract the infection puts them at greater risk of having the complications that emerge from the infection. But individuals that do not have any underlying disease or who have age on their side, what I mean by that, they are not elderly, they are not aged, they are individuals that will likely recover faster than those ones that do have those comorbidities or underlying existing infections. So once we understand that, we will be able to manage the entire condition, and people need to understand that for those that get infected and recover, it's not because the management that is given to them is a cure in any way. It's just some symptomatic management. People are managed for their symptoms, and then they recover because the disease will have run its course and ended at that.
Okay, Dr. Zainab, please clear the air on this. That the immune system that you talked about, could it relate to race? And talking about environments too, because it's been said that with the black race, with the living black people, vigorous, way of living, and of course the vigor they put into their lifestyles and all of that, it is about race. Could it be looked at that way?
Well, researches are still ongoing for us to be able to substantiate those those hypotheses, let's put it that way, because a lot of the times, if you look at it from that perspective, yes, in Africa we've not had it as worse as we see in other developed countries, but you will also recall that in the US, for instance, where we have the number of cases are mainly black people, so that again is a misconception. It is a disease that can affect anyone in any clime. Probably the reason why we are having what we are seeing in African countries is because of the strains that affect individuals in these different environments have actually been documented to be different strains. So this may be a possible reason, and there are postulations to the fact that because we are a highly endemic malaria region, we've had our immunity really boosted, and that on its own can also explain some of the reasons why we're seeing less severe cases in our environment. And then the issue of BCG, but like I said, these are all things that are out there that is still being investigated, and unless and until we get the outcomes of those research or investigation, we cannot readily conclude that These are the reasons why we're having it less than we see in other developed climes. The most important thing to note is that it can affect any race. It is COVID-19 is not a respecter of a race, it's not a respecter of social status, and so on and so forth. It can affect anyone once the conditions are rife or right for the infection to spread.
Okay, Doctor, I will have to come to the audience now to have them as part of this conversation. Please stay on the line. Numbers to call to be part of it. 081 40,000 989, 081 40,000 989, or 070 87 800 989. 070-800-989. Please talk to us. Let's get to know the situation in your area and areas of concern for you, and of course questions to ask the doctor. Hello, good morning. Hello, good morning.
Good morning, sir.
Good morning.
My name is Sunday, Nigeria.
All right, Sunday, let's hear you.
I thank your gift. I've got a lot of nature to your gift here. But what I wanted to ask is that until now, the coronavirus is real. I know everybody knows that the coronavirus is real. What I want to ask now is that what about the Chinese doctors? Are they still around in Nigeria? If they're still around in Nigeria, why coronavirus is still increasing every day? Thank you.
Okay. All right, that's Sunday. We'll take more calls before we come back to the doctor. All right, still with your calls.
Hello, good morning, Mr.
Good morning.
And good morning to your doctor.
Good morning.
Let's hear you. The doctor have made great input in the enlightenment of over-19, and I give up for that. But my question is this: is Kaduna now preparing to open schools? What measure are they put in place so that this virus? That is number one. Then number two, in my city, in Bagodo, I think we have over a population in that area. We have not come across any testing agency to come and test the people in that area, because since this virus is not written in the face, the only symptom we know is running nose, dry cough, fever. So what are they doing to come to this area so that they will test people, so that let the people know it was in terms of COVID-19?
Okay.
That's number two. Then number three, this is the final one. Are some people above coronavirus? Because coronavirus is not a respecter of a person or status. We see some people don't put on face masks. And now, where are those mobile courts that force people to put on face masks? Because look at those people now that they refuse them entering their market, like those in Sabo. Come to that place this morning. Come and see the crowd. No social distance, no face mask. Won't it be better this market be open so that all of them will be in their shop? I think it will reduce the congestion.
Okay, good morning, Emmanuel. All right, we'll take one more and then come back to our guest. Hello, good morning. Good morning. Hello, good morning. Good morning.
Good morning, sir. I'm from the government, Texas man.
All right, let's hear you.
The doctor is saying that for now there's no cure, which I think is being believed all over that there's no cure. But most of the people who have been discharged, what is their cure? Why are they curing them? So we want to know why they are, because if somebody is being discharged now that has been declared negative, for example, how does that person cure? And that's one question also I want to ask. Thank God the doctor is also a lady. We will talk about isolation. Like, in fact, before this thing come, my own wife was telling me to sleep on the ground. She sleep in the bed because they say that's isolation. So I don't know how the doctor will describe this, because that issue we have been touching that issue. So let her clarify that thing also.
Okay.
May God bless her in Jesus' name.
All right, Comrade Gabriel, we got you now. Dr. Zainab.
Yes.
You got, we had Sunday and Engineer Emmanuel, and of course from the rear, Comrade Gabriel.
Yes, I've had. Well, let's start with Sunday, who says, "What about the Chinese doctors?
Yeah.
Where are they now?" Well, I wouldn't have that information,
Okay.
and I think they are not just doctors; they are a combination of different Chinese personnel working on different themes. So probably the federal government will be in the right position to give us that information. I don't have that information. Then, as far as Engineer Emmanuel is concerned, he said, what measures are we putting in place to open up schools fully? This is one of the questions he asked. I would say readily that the Ministry of Education, which has the responsibility of ensuring that the guidelines and protocols provided for reopening of our schools are on top of their own issues. As we rightly know, the final year students are right now writing their exams, and they are being managed and the protocols are being observed. Prior to that, the authorities have met with the school boards, the school authorities, and they've reached some agreement on how to conduct that. And I believe that is happening in most of the schools right now. And further down the line, schools are expected to come up with arrangements. I know that a series of meetings are currently being held on arrangements on the opening of the schools fully. Kaduna State has its protocol. It has also publicized those protocols and shared with those schools authorities, and we hope that total compliance with that protocol will be observed. And then one other question he talked about is testing agency in his community.
Yeah.
I think people that are desirous of having such, right now I know that there are arrangements going on where community testing is going on, active case search is also going on. Various communities are being reached. So if his community has not been reached, probably there's no flag to show that there's a potential case in that community. So the best thing to do in such communities is for them to continue to educate each other and then inform individuals to stay safe. If each citizen or each community member will take that responsibility, it will go a long way in curtailing the spread. So what they need to do is to protect their communities from coming down with the infection. So they need to be very vigilant. They also need to be very observant, and most importantly, obey the safety and preventive measures that have already been laid out. And then one other question he asked is that are some people above coronavirus? Because he had also noticed that face masks are not being used by certain individuals. Again, no one is above contracting this infection. Whether one is rich, one is poor, whether one is an elite, one is, whatever you are, COVID-19 is not a respecter of status. It can affect any individual. So it will augur well for us if each person takes that personal responsibility of ensuring that we use the face mask. The moment we venture outside of our homes and then we come across 2 or more people, it is very important that they keep to the use of this face mask and also observe the physical distance. And then he talked about, he asked where the mobile courts are, because a lot of people are violating the guidelines, that there's a need to prosecute such offenders. And I would want to agree with that. Suffice to say that we have an enforcement team that goes around. They cannot be everywhere at the same time. But the most important thing is for people to really, really comply and obey the rules that have been set by government. For Comrade Gabriel, he was wondering why we are saying there's no cure, while we keep discharging people and say that they have recovered. Like I've explained earlier on, what we do is to manage individuals so that they can come out of a condition. The virus kind of runs its course, and at a point, if individuals are properly managed, they can actually recover. Not because there's a cure for this infection, but because we do all we can to manage the symptoms that individuals present with. This is what is happening. All of the medications that we give people is to just prep them up and to boost their ability to fight the infection. That's simply what is available right now. For individuals that are not able to overcome it, maybe for one reason or the other, because they have underlying or existing medical condition, it can worsen their cases, it can lead to complications and even death in such individuals. So this is one thing that we really need to understand. There's no cure. We can only do as much to make sure that people are able to recover. But again, that's why we say prevention is better than cure. Thank you.
Yeah, and you left something out, Doctor. It's about isolation. His wife is saying, his wife wants to be in bed, and of course he has to be on the ground.
Okay.
That's complicated again, yeah.
Yes. Okay, I didn't quite get that aspect. If, for instance, among couples, one of them has features suggestive of COVID, the most important thing is to self-isolate, suspend all association even with their spouse until such a time that the person is able to recover. So this is what we encourage. And then we also have the isolation centers where we can actually manage if the home conditions are not conducive to manage the couple.
Dr. Zainab Mohammed Idris Kwaru, thank you for coming on the program.
It's my pleasure. Thank you for inviting me.
Thank you. And that will just be about the size of it on the program Perspectives. And this morning, we looked at coronavirus and the status and, of course, where we are with it in Kaduna State and, of course, in Nigeria, too. My guest this morning has been Dr. Zainab Mohammed Idris Kwaru, consultant public health physician and senior lecturer, Department of Medicine, Kaduna State University. This program is sponsored by Kaduna State Ministry of Health. Dashin, thank you for connecting me with the people this morning. And Wisdom, thank you for putting us in the pictures. We'll come back with Perspectives tomorrow. Good morning.
Today's hit music.
Assalamu alaikum Hajiya Amina.
Wa alaikum assalam Sharifa. Maraba sannu da zuwa. Shigo.
Na gode, wallahi Hajiya da alamar kina cin lafiyayyen abinci.
Me kika gani?
Ke da ƴaƴanki sai ƙara ƙyalli kuke yi.
Kai Sharifa, kina da ban dariya. To amma tunda muka fara cin sabuwar pakitin Golden Man na Wazobia ne.